Hi, my name is Sarah Stevenson, and I'm here to inform you about a disease called rhabdomyolysis from a personal perspective. I'm sure most of you have not heard of the disease, and before August 13th of this year, I hadn't either. I had a lot of pain coming from my legs. I thought I was just sore because we were practicing 3 times a day during preseason, but my legs started getting worse and worse, and it was a pain that I had never felt before in my entire life. Again, I still thought I was sore, but it got to the point where I could barely walk. After a morning practice, I was in so much pain that my legs were giving out and I was collapsing. Not long after that, I began to feel very dizzy, as if I were going to pass out. I let the athletic trainers know that I was feeling that way, and after laying down and resting for about 2 hours, I was taken to the emergency room for severe dehydration. It was then in the emergency room that after a few blood tests, the doctor informed me that I had a disease that acts more like a condition called rhabdomyolysis. There are many causes of rhabdomyolysis, but the most common causes include the use of alcohol or illegal drugs, extreme muscle pain and strain in someone who can either be an untrained athlete up into elite athletes also. It can be more dangerous if there's more muscle mass to break down. A crush injury, such as an auto accident, a fall, or a building collapse. A long-lasting muscle compression, such as that of lying down unconscious on a hard surface during illness or while under the influence of alcohol. The use of drugs, such as corticosteroids, especially when given in high doses. Rhabdomyolysis signs and symptoms can be very hard to pinpoint. This is largely true because the course of rhabdomyolysis varies depending on its cause. Symptoms may occur in one area of the body, or it could affect the entire area of the body. Also, complications occur in earlier and later stages. The following common signs of rhabdomyolysis can be painful, swollen, bruised, or tender areas of the body, muscle weakness or trouble moving different limbs, general feeling of illness, nausea or vomiting, confusion, dehydration, fever, or lack of consciousness, dark colored urine, or reduced or no urine output. Blood and urine tests help diagnose rhabdomyolysis. Other tests may rule out other problems, confirm the cause of rhabdomyolysis, or check for complications. Early complications of rhabdomyolysis can include very high levels of potassium in the blood, and that could lead to an irregular heartbeat or cardiac arrest. About 1 in 4 also develop problems with the liver. Later rhabdomyolysis can also lead to kidney failure. This occurs in about 15% of patients. A condition called compartment syndrome may also occur either earlier or later. This is a serious compression of nerves, blood vessels, and muscles that causes tissue damage and problems with blood flow. I was one of the patients with liver problems, but it didn't start to bother me until after I left the hospital. I went to my doctor at home for a follow-up, and he told me that my liver was extremely enlarged and inflamed. Rhabdomyolysis treatments can be being in the hospital for a couple days, which is what I had to impart on, and I was treated with a lot of IV fluids. I gained 20 pounds in the hospital when I was there for a little over 2 days because I was pumped so full of so many IV fluids. I felt like a water balloon. If rhabdomyolysis is related to a medical condition such as diabetes or a thyroid disorder, appropriate treatment for the medical condition will be needed. And if rhabdomyolysis is related to medication or a drug, that drug will need to be replaced with an alternate immediately. After treatment, you need to discuss with your doctor any limitations on diet or activity, and of course, avoid any more potential causes of rhabdomyolysis in the future. I hope that you were able to learn a little bit about rhabdomyolysis. Thank you for listening.